The question is, how do we ensure gender equity in human resource for health?
Thank you.
Yes, sir.
You know, I need to be biased again, and I can always take the example of my agency. I was trained in a communist country. That was Bulgaria, and I graduated in 1988. Then, in Bulgaria, 70% of the doctors were women. 70%. When I was appointed as executive secretary for the primary health care board, I felt as if I was still in Bulgaria because most of my staff are women. In the Plateau North senatorial zone, I counted only 3
and protocols. Then our healthcare workers should be equipped. Apart from the facilities being equipped, the healthcare workers should be equipped too. You don't expect, just like you talk about COVID-19, of course we'll know about PPEs, gloves. You go to certain facilities, patient comes in for emergency and you are asking the relations, please, can you go and get gloves for us? Can you go and get this? This is really not encouraging at all. So we shouldn't only talk of equipping the facilities, but we should be thinking of equipping our healthcare workers to attend to emergencies. And of course, lastly, continuous professional education. Very key. Thank you.
Okay, thank you very much. Ladies and gentlemen, can we give a clap to our panelists? By the powers with, sir. Okay,
so
sir.
I think I actually wanted to say something because my CMDs, provosts, and leaders are here. And I think that this concept is going to help promote the healthcare provision services as well as the quality going forward. And it's a concept I talked about, what is called brain circulation. And I think this is critical that we begin to establish a relationship with our colleagues who have left the country and in overseas. We can have programs where our local doctors and nurses can go there and have spent some few weeks or months and gain some skills and return back home. This is going to increase motivation and satisfaction, and is going to ensure that skills are transferred back home to improve our care. Thank you.
Thank you. Yes, sir, indeed. Briefly, sir.
Thank you. I'm going to be very brief. You know, when it comes to emergencies, I just want us to understand that Plateau State is doing great as far as emergency preparedness and response is concerned. It will interest you to know that our disease notification and response officers are doing us proud. And I feel, I must say it, because I retired as an epidemiologist. The CMD from Jude will agree with me that we did so much work as far as Lassa fever was concerned. Let me tell you that our DSNOs came second in the federation. They came second. In fact, I've told my other program managers to learn from them. And I must thank WHO for doing a great job. In fact, if not for you, and maybe too, if not for the groundwork that we did, the support they get from government, I'm sure, you know, they couldn't have achieved that. But they are second in the federation.
Before this session, we had a presentation by Dr. Wika. I would want him to take the stage so that he will respond to questions that may come from the audience. Dr. Wika, sir, to the stage. You know, please, because of time, I know, Dr. Jonathan, you are itching to talk. But because of time, if we have time, you will talk. But this time around, I want the audience to talk because you can sit down, sir. Take it. I want the audience to talk too. So we are going to take, you know, let me say something. if you observe, close to 100% of the issues related to the discussion have been mentioned, and then solutions also proffered. So we shouldn't be saying the same thing in different ways. And so I'll give a chance to about 3 people for this session. And like I said, please, let's use that, that method. I was blind, now I can see. Please, I can see the CMD Jude, and it's like all the hands are coming from this side. Yes, and then you. So 1, 2, 3. The man with yellow shirt. No, this, and then for Dr. Wika, any questions? Okay, 1.
Hello?
So all in all, we have 2. So we have 5. Yes, sir.
All right, thank you very much, Pharmacist Lenka, for this, and the panelists for a great job. I'm Dr. Paco Bupada, the Chief Medical Director of Jos University Teaching Hospital. Let me just add to just a comment on how to bridge the gap for human resource for health in Plateau State. You've talked about using technology. I think we can leverage on telemedicine.
Yeah.
Telemedicine is a technology for those who are in the rural areas. For instance, in General Hospital, when Dr. Bishman mentioned the limited number of doctors and health workers there. So if there's a connection with the Plateau State Specialist Hospital or just University Teaching Hospital, through telemedicine, the persons there, they can see on technology to be able to consult with colleagues here. That can help in one aspect. The other one, which our past Chief Medical Director initiated when he was the CMD of Youth, was a collaboration between Jos University Teaching Hospital and the state government and hospital management board, taking some of our residents from Jos University Teaching Hospital to some of these general hospitals as rural posts. By the time we do that, but you must create a conducive environment for them, that's accommodation for them as an incentive, give them all that they need because they're in residency, give them internet so that they are not cut off from the world, give them, those resources, and then the consultants will be going there to supervise them. As I'm talking to you, we have over, let's say about 500 resident doctors in youth. Why can't we leverage on that? I know we've started that with the Commissioner of Health, and our consultants, heads of departments, went to some of these general hospitals to look at the facilities in preparation to see how we can be sending residents on rural posting. We can leverage on that to further address the issue of gaps. But beyond just the doctors, the nurses, all the different cadre, the healthcare mix, we need to look at all of that to replicate that. So thank you very much for that. And then the other thing that we can do in primary healthcare, sir, thank you very much that the governor has approved the employment of over 1,000 health workers. At the primary healthcare level, thank you that our local government chairman are seated from morning till this time. The chairman of Algon and his colleagues, this is really commendable. Now, how do we ensure that our PHCs have the healthcare workforce? You see, let's not just go and employ, because one of the challenges that I discovered when I was doing residency, we went to do a survey. When you go within the weekends, the health workers that are supposed to be in the PHCs, they're hardly there in those PHCs. Why? Because their families are not residing within those localities where those PHCs are. So they will come and do maybe 2 days in a week and then go back to reunite with their families. So why don't we adopt a strategy where we identify people who have the qualification within the community that are already residing, they are married and staying there. Take them and send them to College of Health Technologies or Panshin and train them and come back because their families are already there. You don't need transfer, no leave, no transfer, because they're already there. And whenever pregnant women come, of course, they can go and call them from their houses. You don't need to build a quarters for them because they are within the community. So we must be strategic in doing that. And when we're talking about even skilled birth attendants, those community health extension workers can be empowered. At least they know anatomy, they know some of these things, expose them, and we will have a practical solution to some of this human resource for health. Engaging the community development associations. They can come into to people that will stay within our community. Not this one that you post somebody from the local government PHC to go to that place, they will spend 2 days and say they are going to see their families, and they are never there when emergencies come. So on this note, I believe let's adopt this practical solution in this Council of Health to see how we can be intentional in training people within communities where there will be no leave, no transfer. Thank you very much.
Thank you very much, CMD. You have spoken loud and clear. Thank you, sir.
Can I add to what he has just said?
Yes, sir.
Yeah, so thank you very much. The chairman of Riom local government is here. He has come to my office 3 times with this suggestion you are making. And one of the reasons he mentioned to me was because of the crisis. That his community, all the people that are posted there, most of the time, once there is crisis, they run away and they never come back. But that some of the people that are within, when there is a crisis, they may run for some time, but eventually they will come back there. And I think I've discussed this with ES, because it is key to what can address some of these challenges of our health workforce. I can tell you what he has said is very true. On weekends, just go to some primary health cares around your local government. You discover that most of them have run to Jos. They are in Mangu, they are in the cities. They are no longer in the community. Then when a pregnant woman comes at night on Saturday, nobody is there. So we thank you for this suggestion, and I think it's something we need to take and move forward. Thank you.
I'm sorry, I have to interject here. Professor Ishayapam, former CMD, Jos University Teaching Hospital from 2005 to 2013. And I want to thank my successor here for mentioning a few things that we did then, which we need to continue. The issue, he has addressed the issue of residency, the decentralization of healthcare. Youth, for example, has more health personnel than all 5 states put together. 500 resident doctors is a huge number of personnel, and I believe 300 or so consultants. And then we have Plateau State government. How many staff do you have? How many doctors do you have? I don't believe it's more than 50, 60, 2 per general hospital. So it's a matter of distribution and the efficient use of our healthcare resources. And we have the same when you talk about nurses and the other health professionals. So we need to go back to the drawing board and decentralize the services that we can offer. Indeed, Youth was able to resuscitate faith-based hospitals. SDA Jingil, for one, needed to be resuscitated, and we brought it back to life. Vom Christian Hospital also owes its continued existence now to this collaboration that we had and partnership. And we also went on to give visiting consultancies to our state indigents and others who reside abroad. And today, Dr. Oka, a vascular surgeon who was once a consultant in Jute, comes every year to perform plastic surgery and vascular surgery almost at no cost to Nigerian government. We also had Dr. Ladeb, a hepatologist who used to come, and several others, a pediatrician, Dr. I've forgotten his name now. So that is part of how we have been able to address the issue of brain drain. We can bring back many of our colleagues for short periods of time to give back to the system. Fortunately, the CMD now has the capacity to at least give them airfare back to their various stations. So, because if you send our doctors out, I'm sorry, they will not come back. All the initiatives, we have medical trainings abroad, they don't come back until those training programs are eventually cancelled. So thank you very much, and we hope that this council will be able to work on some of those initiatives.
Thank you very much, sir.
Thank you very much for all those who made those critical contributions. They're key to our conversations today. Unfortunately, we don't have all day. We have tomorrow again to continue. So please, if you have any comments to make or questions, please be mindful of time. We give just 60 seconds to anyone who has any contributions to make. Thank you so much for your contribution.
Thank you. So I think my friend, Dr. Lenka, he said something about gender, and on your stage, I didn't see any lady. That is on the laughter mode trans. I just want to appreciate all those people that have spoken. But honestly, they said necessity, the mother of all inventions. And there were societies that got stuck, just as we are stuck now, in problems. And I think the discussion has been, how can we bridge the gap in human resource in health? I appreciate all discussants. I don't want to specify, and I think somebody has given us a ratio. And I look at almost all professions in health. That ratios, or those ratios, are very, very bad. And somebody mentioned what local government chairman did, bringing people that studied other courses related, let me use that word, but I don't know, related to health. I don't know if it's very close to the solution, because politicians think very deep before they take decisions. My contribution might be a question, it might be a food for thought. There are approaches to managing problems. And somebody said, you can use role-centered approach, or you use attitude-centered approach. And I thank God, Dr. Weka, you talked about traditions. It has been like traditions in healthcare. Certain people must do certain things. Any other person that is doing it and is doing it very well, that person is a quack. With the problems we have, I don't know if Nigeria can adopt role-centered approach or attitude-centered approach and look at other professionals. And I thank my uncle, Dr. Pam, by telling me that's the naked truth. If you take people abroad, how many of them come back? And some of us are here because we don't have the money to go. And if government gives us the money, why should I come back here? This is the naked truth. So I don't support that idea of sending somebody to train and come back. Those that have gone and come back, yes, they should be given incentives.
Thank you, thank you.
Thank you very much.
Thank you, my colleague. Thank you, sir. Thank you. Sorry, before then, sorry, please, hold on. No, let.
Hello.
He wants to. Yes, sir. Go ahead, sir.
The mic is on, sir. Okay.
Hello.
Want to respond?
I'm so sorry, but I need to make a comment or make a reply to what the CMD of those university teaching hospitals said. I quite agree with you, sir. Absolutely. And I'm happy that my commissioner is here. First and foremost, I want us to understand that most of our workers, health workers, are women. And in most facilities, you find out that there is one woman or one worker that is there. That worker, health worker, cannot run 24-hour shift for 7 days, 2 weeks, and for a month. Definitely, they must go back to where they come from to attend to their children, to attend to their husbands. So our thinking, sir, is that we should have a policy change. And I agree with you that if the staff are to be domiciled in their own villages, in their own wards, I think we'll go a long way as far as, you know. So we're here to take decisions. We're supposed to take decisions, sir. And I would want a situation whereby we adopt this kind of decision, because the policy in government is you are posted to another local government. It's like an unwritten policy. But as you can see now, it doesn't look good. So we're here to take decisive decisions. And I think we have the opportunity to do that so that we can repose people back to their wards of origin. Thank you very much.
Yeah, thank you very much, sir. Let me plead again. You know, the issues of human resources, if we continue to talk, we may not live here. And please, I beg that if you have, you can put your submissions, you can write them on paper, and then the commissioner is here. They will be forwarded to him. Meanwhile, yes, the Algon chairman, sir, you have the floor, sir.
He's calling a different person. Okay.
Ask your question.
Permit me to stand on the existing protocol. Sir, I really want to concur with what the CMD just said. I think that's a serious development. I want to give a specific example. We have both primary, secondary, and tertiary institutions. But most of the times, we refer our cases to Bauchi. You know, our people are closer to Bauchi. They prefer going to Bauchi than coming to Jos, which is very close. And that is just the reason. Most of them are not staying in that hospital. Even the FMC that is just established. I know FMC has employed more than 600 staff. But you will get there, you will not see anybody. I'm telling you, sir. Because just last month, we have a serious crisis bringing the people that were the victims from bush. At the end of the day, when we bring them to FMC, we have to take them to Bauchi immediately to save their lives. So this is a serious thing that we have to look at it very well and then take decision. In regards to saying by the commissioner that the chairman employed people that are not part of it, that was what brought me to ES I think it's last month. Is it last 2 weeks? We've been having problem with the staff. The director doesn't even involve the chairman in the employment or anything. He's there. I went there now talking about the director, that we don't know what is really happening. They are the one that put the names, and most of the names, you know that the directors are not from the local government also. They fill in the gap with anybody that they wish they can fill in with. Not the chairman. The chairman doesn't do that. We don't even know what they are doing there. That's the problem we are having. That was what caused me to tell the ES to transfer that woman, because she did this thing 3 times in my local government. So actually, sir, there is a break of chain in the line of action between the chairman and the primary health care. So we have to look at it very well. We should have synergy and work together as one. Because most of the times, we just see things happening. They will say, is malaria something that we don't know how it's going on. As the chairman, that's exactly what is happening. So we have to synergize together, work together, and we have a prior review together and work as one. Despite the fact that anywhere we go, that this thing, I heard one of the speakers saying, the right way to approach this is bottom up, not top bottom. So we have to sit down and look at this thing very well and work towards the success of this of the healthcare as a council. So please, we have to fill the gap and see the necessary thing we should do to save the state. If it works, all the employees should go back to a local government. I have the same case. Once the staff is sent to us, you will say they will kill him. You will go there, we will see nobody in our primary health care. I happen to go around at 1 a.m. to the primary health care that is within the local government headquarters. No staff there in the night. When the security man was telling me, please go to Sakoga. Sakoga is one of the private clinics. So I think this thing needs to be looked at it. We have to look at it very well to take decision here from today and tomorrow, take the necessary decision on how to solve this problem, so that we should achieve what we want to do.
Thank you.
Thank you.
Thank you, sir. Thank you. Thank you.
Briefly, please.
Yes. Sorry. Yes. Thank you. Thank you. Thank you. The Algon chairman has spoken, and please, I observe that we have his contributions that are coming in, not questions. So please, can we put down our contributions? There are memos already, and some of the memos are going to address some of these issues that we are bringing up here. So I suggest that we put down our thoughts on paper. Okay, the chairman of this occasion is here. That's the chairman of the organizing committee is here, the Honorable Commissioner himself. If you put them, they will be forwarded to him. So on that note, we have come to the end of this session, and I hand over the mic to...
Thank you. Thank you so much, the discussants. There will be a photograph before you leave the stage. And thank you for your wonderful contribution. To the audience, I know that if we give an opportunity for everyone to speak today, we will not come to the end of this. So there's going to be a memo on the discussion of human resources for the health system tomorrow across all boards. So if you want to continue to be part of this conversation, don't miss tomorrow, because tomorrow promises to be bigger and more engaging. Thank you so much for staying through today. Like I said earlier, we're rounding up this session and today's program finally now, and we will go straight for lunch. So please be seated where you are. The ushers will come direct you to where the lunch is. And we would please kindly adhere to the directions given by the ushers. Be seated, because we do not want to experience the same rowdiness that we had earlier in the morning. So please get seated. The ushers will come and we'll start from the front row to the back, so that we'll all have a more organized lunch time. Thank you for your time, and I still remain the moderator for today, Kienpia Best. Thank you. Okay, so I've been given the directive for us to take the national anthem. So please, can we all stand and say the national anthem before the lunch? That brings us to an end of today's session. Can we all be on a standing ovation? Please, before
position Plateau State health sector for universal health coverage. Thank you.
Yep. Yes, we will sing the anthem. Media, please.
Hi, my name is Yulji Kashmaya Kumtap. I'm the chairman of the Nigerian Medical Association.
Media, please.
Nigeria, we hail thee, our only native land. Both tribe and tongue may differ, in brotherhood we stand. Nigerians all and proud to serve our sovereign fatherland.
Thank you. Thank you so much. Please be seated. Please be seated. The ushers will take you to the lunch table. Be seated, please. Thank you.
Chapter. I would love to invite you to the 11th Plateau State Council on Health, which comes up on the 18th to 21st of August 2025 at the Crispan Hotel and Event Center here in Jos, Rayfield. I invite you to come together